Chapter 16, Nursing Assessment. Here are your objectives. The nursing process has 5 steps to it: assessment, diagnosis, planning, implementation, and evaluation. The nursing process. The American Nurses Association in 2010 developed standards that set forth the framework necessary for critical thinking in the application of the 5-step nursing process, ADPI. Critical thinking approach to assessment. Assessment involves collecting information from the patient and from secondary sources like family members, along with interpreting and validating the information to form a complete database. There are 2 stages of assessment: collection and verification of data, and then analysis of the data. Here is the nursing process from your textbook. Types of assessment: patient-centered interview conducted during a nursing history, periodic assessments conducted during ongoing contact with the patient, physical examination conducted during a nursing history and at any time a patient presents a symptom or a change in status. Here's your case study. At this point, what do you expect to find during a postoperative assessment of this client? There are different types of data. Subjective data means patients' verbal descriptions of their health problems, includes their feelings, perception, and self-reported symptoms. Objective, these are findings from direct observation. Objective data means I'm applying the critical thinking intellectual standards so I can correctly interpret the findings for this patient. So, what type of data is this? So there are different sources of data that we can get during the assessment process. We can get them from the patient, family caregivers and significant others, the healthcare team, medical records, other records in the scientific literature, and the nurse's experience. The nurse-patient relationship and assessment. Effective communication with clients and their families and significant others is important and creates a foundation for nurse-patient relationships. It builds trust, presence, and we do rounding on all of our patients, which means we visit them at different intervals throughout our shifts. So how do we develop the nurse-patient relationship when we're collecting data? Well, we interview the client, we observe them, we do a physical examination, which is the best source of information. Family and significant others can also provide us with information if we have the patient's agreement first. And then the healthcare team, medical records, and the scientific literature, and this all forms our database. So we do a patient-centered interview, which is an organized conversation focused on learning about both well clients and sick clients and why they seek care. So you need to prepare for the interview, use effective communication. So there are different phases when you're interviewing a client: orientation and setting up the agenda, the working phase, and then appropriately terminating the interview. You need to display professionalism when you're doing history taking. We also need to show a caring approach and look at the patient and not at the computer screen as much as possible. Now, you need to use the computer if you must, but position it in a way that does not distract you from the focus on the patient. So, during the patient-centered interview, you will learn which components of the health history to explore. To conduct an accurate and complete assessment, you need to consider a patient's cultural background. When cultural differences exist between you and a patient, respect the unfamiliar and be sensitive to a patient's uniqueness. If you are unsure about what a patient is saying, ask for clarification to prevent making the wrong diagnostic conclusion. Quick quiz. A patient is admitted to the hospital with shortness of breath. As the nurse assesses this patient, the nurse is using the process of Here are components of the nursing health history. We need biographical information, the reason for seeking health care, health history, psychosocial history, the patient expectations, present illness or concerns, family history, spiritual health, and then a review of systems. So the nursing health history also includes diagnostic and laboratory data. The results provide further explanation of alterations or problems identified during the health history and physical examination. We need to interpret and validate the assessment data. We need to collect a complete database, which will lead to the second step of the nursing process. Data documentation is important. We use clear, concise, appropriate terminology because it becomes a baseline for future care. So observation of the patient. It is important to closely observe a patient's verbal and nonverbal behaviors. Observations direct you to gather additional information to form accurate conclusions about the patient's condition. An important aspect of observation includes a patient's level of function, the physical, developmental, psychological, and social aspects of everyday living, and these vary from client to client. So data documentation. We need to record the results of the nursing health history and physical examination in a clear, concise manner using appropriate terminology. Record all observations succinctly. The baseline to identify a patient's health problems, to plan and implement care, and evaluate a patient's response to those interventions. Record any subjective information by using quotation marks, such as the patient states, and put it in quotation marks. So, which of Yolanda's questions to Mrs. Tompkins address her pain? Quick quiz. The nursing process organizes your approach to delivering nursing care. To provide care for your patients, you will need to incorporate the nursing process and do you think this is true? The assessment process includes data collection, interpretation, and validation. There are different types of assessments. Look at the picture of this nurse and this client. This male patient looks kind of uncomfortable in bed. Patient presents with discomfort in a surgical area. What are your cues? What inferences do you make from the cues? So this is continuing of the patient data, questions we can ask to assess the patient, and then patterns that we see. Concept mapping organizes assessment data by placing all the cues together in clusters that form patterns that lead you to the next step of the nursing process, the nursing diagnosis.